But at least for us in this country, it has been very low comparatively to other countries. And the second thing, if you are talking about is reducing zero AIDS-related deaths, also we have established about 10 art sites providing treatment to people living with HIV and AIDS free of charge. And also, if you look at even for the prevention, we are now moving towards elimination of mother-to-child transmission, which is also talking about zero new infections. The stigma and discrimination, that's where we are actually facing a lot of challenges. But for the other two areas, we are doing a lot in those two areas.
So apart from the sensitizations, Mr. Baji, what else can we do to curb the menace of or the problem of stigma and discrimination?
Stigma and discrimination, like has been mentioned by Pa Usman, is quite a complex phenomenon. Sensitization is very key. Again, I think we also need to kind of do some basic research to understand, because sometimes you will find people who, by way of their education are highly qualified. But paradoxically, sometimes some of them, their knowledge on HIV and AIDS is found to be quite high, but it does not translate to their positive behavior in terms of how they relate with those that are living with the disease. So it needs more sensitization, yes, but I think we still need to do some research to understand better the magnitude of the problem. We concluded one called the Stigma Index Study in 2012, which was validated in 2012. And the revelations from that were kind of very disturbing, in the sense that you're talking about 64% of those that were interviewed, I mean people living with HIV and AIDS, did confirm in that study that they have, in one way or the other, faced some kind of stigma or discrimination, related to their status as people living with HIV and AIDS. And then, if you look at the environment within which it occurs, like Pa Usman indicated, at the level of the society, at the level of the family, and
at the level of the health,
even at the level of the health facility, in some instances you find people living with HIV reporting, stigmatizing or discriminatory practices that are directed towards them. And so for that reason, this is why I said it's quite a very complex phenomenon. Perhaps beyond sensitization, we still need to do more research to be able to come up with appropriate messages and interventions that would go a long way in trying to address. But this is something that cannot be left to the institutions that are responsible for the coordination of HIV activities. I mean, since it is happening at the level of the family, it is happening in the community and in other places, it makes it a bit more complex for us to ensure that we get to the zero related to stigma and discrimination.
It is important for us to get some of these messages across to our local listeners. But before we turn to our local languages, Usman, I would like you to talk about the programs available as far as parent-to-child transmission of HIV is concerned. You made mention of the First Lady's intervention or interest in this area. What can you tell us about that?
Yeah, thank you very much, Sally. Pa Usman did mention that we have a number of interventions that have been rolled out years back. And PMTCT is quite a key area. And like I mentioned, yeah, you're right, Her Excellency, the First Lady, has always been, an advocate, a champion as far as the prevention of mother-to-child transmission of mother-to-child transmission of HIV is concerned. And as we speak, we now have up to about 32 PMTCT sites. These are places where, if, for instance, as a mother you are diagnosed or you are found to be living with HIV and AIDS, you can go to any of these 32 sites and be provided services that can ensure, with the new classes of drugs that are available and appropriate interventions. This is why the world is saying that it's possible for you to eliminate that possibility of transmitting the virus from the mother to the child. So these 32 sites across the length and breadth of the country, is where we provide services related to preventing the transmission of HIV from the mother to the child. So we working on, we also did a study, the elimination, the bottleneck analysis on PMTCT, to try to understand what are those underlying problems that continue to hinder, the provision of such services in some instances. And that study, is also helping us to see how do we expand further to provide, because the ultimate aim is to ensure that HIV services are also provided at the doorstep of Gambians. So we are also working towards expansion in that regard, so that access is definitely enhanced.
Okay, baringol albila jibero la jatis television leto nying kachami along ko nga kere HIV AIDS kurangola bitung ali pa Usman Ba jijang studio to jang anim pa Usman Mani pa Usman Ba pa Usman Ba sai coming itelem alfati mimbotana National AIDS Control Program mimbe jata kenya ministry koto mbela fila edim baringol kasha HIV kachami along ko mbewole ke kanjang mune ya kunmayande aning Gambia banko kanjang mong simfa dal lebeta kam pour kaje ko kam ni HIV kol kelo ni sembentu ya banko kan
baraka bake mbe mbari juberlal be kontonna comme ya fonyamin nyimu programme leti mi ya lonko office of the first lady wolle dépasse anum akumasta nyamin wolem ko nyin African president la musul wolle kafolo pour kaji ko kanyin kurango nyin kele bari ka kele nim fanna jamal bari kabiri nga wolong nga launch nu Gambe yang fanang jam fana e buludo soro e kamin fo aflagam wo fanang wobe president la musole koto anu at pour simfal minta pour kaji ko nyin kurango nyin amang janjam mo jamal kono so nyin dépasso nyin nga bondi wo dulalto ila wo bundalto pour ka mol fahamiande nyin kuran wala kula bari na nyin kacha nyin jama habitat to sugula dulaminto wolem ko nyin kuran aka saw bato nyami kata dindi moto e kami fo moto child transmission o nyin kacha bitala wo fannala katu wonna ferwol ngamin la niaju be wolem ko mala fi dindingo dindinge nyin kuran o soto nyin Gambe ko ay wulu nyin banko kan ay nyin kuran o soto so walatin nga nyin l'hôpital to l'hôpital jama bi jang Gambia kono kata fo fatoro l'hôpital bi je mi yalon ko ni tata ika mo musol kacandile ani yelo visite ka jube fo yasoto fo masoto nata e masoto fanan ise kacandi isaje ikakana inene kana soto nata fana yasoto le isaje ko ise makoy e dema ye borol di la mi yalon ko ase dindi mo tankano nyin ko bawo to yasoto le bari fanan ferol min beje sayim niaju be sayim borol min sotoda wo fanan ka bama fanan mako le pour asiyo jamfa katu ko kiskisiro la tandi ko jama natara banyin kurango balal hannata dindugo ma soto nata ba fata junol jama dindugo fanan ka faale so walatina sayim ferol min lata wolem ko kaje ko ka banin dingo be makoy although ha banyin to nyale ma ya soto le ay wo bawo ngalon nyamin to la borol to sayim ni bami te kende ala bar se sio jam fandino anum ase jata kende afnan dilano bari te kuran keso nyum bete bola bari dindingol nyin sa tankano nyin kuran wala so wo programme wo be l'hôpital tan sabanin folalto nyin Gambia kono although hani sa en tageto lafta minna hamom min hani sa mo soto no
abuko mol man tara finti kan ko nyanta
hani mol ka finti le bari l'hôpital man tara dulal beto dama ko l'hôpital bele kadi bawo ni ajube nata kemeo nata l'hôpital kemelem nsafo no atalantele kadi sai katu ko ni ajube inka tan nyi l'hôpital min foye comme tan sabanin folol mi yalon ko wolle kadi fen dol bi jem l'hôpital dol bi jem min tamita l'hôpital tan nan le mi yalon ko ni taraje te nyi service fa sur laje bari ngaaji ko tundol be kono ya soto jele bari hani sain la tam ka minnata hani sain ma soto
okay
bari ka minke wolem ko nata muso kono ma nata nke kacandi la folo kay tandi la ko nyim programme be janne pour calma koy natara mu uran keso be la isaje yi dingo nyin sa tankano nyin kurama sai ni sonta den nge visite natara ya sotole den se isaje isi dum wo demar bundato mi yalon ko ni e borol dila isaje dinno nyinte kuran keso nyin sotol
So kabrinyi mpuo program o datitani mbitema ise mune fonye no munyato ta kuole sutu ta kuo kona ali mune jiji
ha nyato ta ku jemale kita je